Indeed, it is not often I get this honor to be with a distinguished gentleman whose legendary work knows no bounds. That is his commitment, drive, ferocity, and focus, which precious few have nowadays. Mr. Lal Goel, indeed, he should be called a doctor because he's done so much of work. He should be honored and kept on the highest pedestal. Thank you and welcome to the show, Mr. Lal Goel.
Thank you very much, Dr. Devan.
Well, a variety of topics. I talk to him on anything and he will talk. But so much of noise is made about Vigovi and Manjaro and a whole lot of these GLP-1 drugs that the first time I'm coming across somebody who has been on it. We've been reading quite a bit about it, and sometimes we are not really clear as medical professionals how it can be applied and what is the dosage, what is the cost, what is the frequency, and how it can be stepped down. Today, we have a distinguished gentleman who has been on these drugs for quite a while, and the phenomenal, miraculous benefits he has derived from it. Sir, I would please request you to talk about Manjaro, Vigovi, and the Ozempic. What was your journey through? What made you start it? What is the cost? Can the common man take? What is the side effects? How's the pain? And how have you stepped down? And what do you look intend to do in the future? And what benefits you have procured as a consequence thereof?
Thank you very much, Dr. Devan, for asking me a very, very important question. Yes, about a year back, somewhere in May 2025, my weight was approximately 81 kg at that time. Although my parameters were almost normal, but my brother, Dr. Rotarian Goel, is a renowned bariatric and diabetic surgeon at Wokhard Hospital and PD Hinduja Hospital in Mumbai. He suggested me to go to start with a tablet called Ribulsus of for GLP-1. Although I was not having any diabetes, but the weight was a bit issue which I am started facing when I used to go for morning walk. After some time, I feel tired like that. So I started with 3.5 mg Ribulsus tablet. At that time, the cost of the Ribulsus was about 300-400 rupees. So it works out to be about 16,000 rupees, 18,000 rupees a month.
That you take daily.
The daily tablet. After that, he stepped up the dose from 3.5 to 7 mg. And after 2 weeks, again, he stepped up to 14 mg. So for first 3 months, I was on the tablets. Then he put me on the injection.
What is the effect you found at that time, 3 months?
My weight was reducing about, in the first 3 months, it has reduced about 7 or 8 kg. After that, he put me on injection Manjaro. And injection Manjaro 2.5 mg. It costed at that time about 16,000 rupees for 4 doses. Every week we have to take.
So one injection is
16,000, but it is a for 4 dose injection.
It comes as a multi-dose vial.
Multi-dose vial, and it is like insulin. It has to be taken intramuscular with a very thin 32 gauge needle.
It comes with the syringe and needle with the pack?
Yes. That injection. Then again, I have started reducing the weight. Then he stepped up from 2.5 to 5 mg after a period of 3 months again. And after 7th or 8th month, I stepped down from 5 mg to 2.5 mg Manjaro. And gradually I was reducing the dose of Manjaro under his advice. Then my weight came to approximately 64.5 kg. So I reduced at approximately 16 to 17 kg.
Without any extra exercise or diet?
No, walk every day I was doing for last 10 years after my heart attack.
But there was no change in any of these things?
No, nothing. But only thing, the change which I found is that your appetite goes down. Because this injection, which I was told, I am not a doctor, but it is that it works in threefold. First fold is that it kills your appetite. Second, it reduces drastically the diabetes, although I am not a diabetic patient at all. And thirdly, definitely the obesity, the weight. So my weight was reducing, and I was quite comfortable. Only thing is that with this injection, two three things are required very rigorously. One has to do. First thing is the protein. The protein requirement is there, because because of this the muscles loss will be there, and that's why to keep yourself healthy one has to take the proteins with the as per the body weight. And I started taking the protein smoothie every day, which I am taking. And
That is, you have a protein powder,
protein,
mix it with milk, and you add sugar to it.
no, I am not taking with milk, I am taking with water. Not even water, I am taking with the ice. I am making a smoothie in
What
the mixie.
protein powder you are?
It is a vegan powder. Earlier I was taking the soya powder. Now it's a chickpea protein powder, and it's having 25 mg protein. Plus,
So you take 3 tablespoons in a
no,
half a cup
it's
of.
a one scoop is having 25 mg. So I'm taking the 25 mg thing every day. Plus, I am also taking the homemade paneer made from the slim milk and the slim curd every day, as the paneer, or chickpea, or the rajma, or dal, where I can have the protein, sufficient protein every day. 1 hour brisk walk, which I was doing for last 10 years, that I am continuing. And the hydration, that is very important in this. So I consumed about 2 liters of water every day. I am not consuming more because of the prostate, but it is effective in for prostate also. I found that my prostate size has gone down even after this Manjaro. I was put on Wegovy for some time.
Why the change?
Because Manjaro is basically having two components for obesity as well as for diabetes. And because I was having no diabetes, so they put it on Wegovy first, and then now in Ozempic, because now Ozempic is available locally and the cost has reduced like anything. Now it is available for 4,000 something, because I am on the minimum dose of 0.25 mg every week. I am taking that dose. I am maintaining the weight, and I am very energetic.
At about 64 kilos.
Now I am approximately 64 kgs. And one more thing which I found is the urge for the alcohol goes down drastically. And that some research has also come out in the newspaper I read, that the urge for the alcohol goes down drastically, that you are not having any urge that you have to drink. If you doesn't want to drink, you will not drink. So that is also a plus point. And why I am taking now, because many people, in India, everyone is a doctor and everyone is an advocate. So they always give free advice. So they says, why you are taking injection? What about the side effects? I want to tell very clearly two things. First thing is, when we ask about the side effect, have you ever thought that if you are taking a Coca-Cola or Pepsi, or eating Golgappa, or eating a burger, what are the side effects of those things? We never ask for that. We only ask for these things. These are researches have been done. Now recently, 5 days or 6 days back, Indian government has also approved Wegovy for the reversal of liver disease, liver cirrhosis, which is going to a miracle. I had a talk with one of the leading doctor of Mangalore earlier, and he says, Mr. Goel, this is a drug which has come out after 150 years after the insulin, which is a miracle drug. And because of this, I found many of my friends and associates whom they have been put on this injection, that they quit the insulin in a very very early stage, within a month or so, and after that their diabetes tablet which they are taking, has the quantity has been reduced drastically. So this is a miracle drug, no doubt about it. And it is very good for the organs, as you know that, as I am working for organ donation for last more than a decade. and I found that if a person is on this, definitely under the supervision of a doctor only, medical doctor, then this is very good for the health of organs. And as I am the founder and charter president of Rotary Club of Organ Donation International, every week we are having our meeting, and we call experts of different fields to talk. And those who are expert in liver, those who are expert in kidneys, and those experts in heart, they all says that this injection, if taken under the medical supervision, this is a miracle which is giving good relief for those who are suffering from these diseases. Already the approval has come from the for the liver. I am sure that near future the researches are on, may many more approvals may come. So I am very happy, Dr. Devan, that this thing, my life has changed. The tiredness which I used to feel earlier after my 1 hour walk, brisk walk, is not there. I feel myself more energetic. My appetite has gone, and so I can do more service to the society as the founder and charter president of Rotary Club of Organ Donation.
India being the diabetic capital of the world, don't you feel that there's a miracle advances in the field of medicine and hundreds of lives it can save and open a gateway to health? Isn't that so?
Yes, doctor, and that's why I can give you figure about 1 year back. Uh, the sale figure was 85 crores of injection Manjaro, which was number one every month in India, is number one drug which is sold in India. Earlier, the antibiotic used to be number one, but this has overcome, and now I was told that it is selling in few hundred crores every month. So one can imagine the potential. But only my advice which I want to give to all those who are watching this on global TV, that please consult a qualified medical doctor who is expert in diabetes or who is dealing in this field, so that you will get the prescribed correct dose, because overdoses is very harmful, less dose is also harmful. It should be a proper way for your body weight, which I know that Dr. Devan himself is a giant, a renowned person in ENT, and his research work and his treatment to the patients is renowned everywhere. You know that without medical doctor, if we will go to a quack or to someone who is not having full knowledge, then it can have after effects which should not be there. Otherwise, I am very happy. My testimony is that this is something which one should use if you are suffering from diabetes, if you are obese, even if for liver. But please consult the expert doctor, a diabetologist, or a person who is dealing with the liver diseases, so that you can get the proper prescribed dose.
You have encountered many reversals on diabetes. Would that primarily because of the loss of fat?
There are two reasons which I can see. For one is the definitely the loss of the fat. Secondly, the urge to eat. See, the problem in India, as you said, that is capital of diabetes. In India, we are eating whatsoever we are getting, and but if our brain is not giving signal to eat more, earlier the whatsoever our stomach is urging, the brain is allowing, we are eating. But because of this drug, the brain is not giving the proper signal that to urge to have more and more things to eat. So once you will not eat much, then definitely you are not eating unhealthy. And once you are not eating unhealthy, definitely your diabetes will come down. Plus, I am sure that one of the component in this is also working to create insulin in the body. That's why this thing is happening.
So the urge to eat is primarily driven by a hormone called ghrelin. Presumably that hormone level is coming down, so you don't feel like eating, no hunger. Has your eating habit substantially come down?
Yes, eating habit has substantially come down of mine.
So if I call you for a lavish dinner tonight, you might not accept. Wonderful.
Doctor, you have seen today
Yeah.
that before you, the
Yeah.
other doctor was here. He was having a club sandwich.
Yeah,
I
yeah.
have not taken.
Yes, yes,
You
yes.
also have it, although you have
Yeah,
only
yeah, yeah.
taken the needle dose. I
Yeah,
have not
but
taken because I am
I really
having.
admire your restraint in these matters. It's been a wonderful evening, a large exposition of knowledge about these drugs. I mean, most doctors would not have, I had no clue. I mean, for the first time, I'm meeting a person on these drugs and hugely benefiting from me. Thank you so much for this opportunity to Global TV.
Thank you very much, Dr. Devan, and thank you very much, Mr. Paul, Chairman of Global TV, for inviting me and introducing me my old friend, Dr. Devan, who is a well-known moderator and who is doing so much social work. And I wish a long life
Wow.
and a healthy life, Dr. Devan, to you
Wow.
also and to your all patients. Thank you very much.
Thank you so much.